if you move constantly your needle, and if you aspirate, you never inject. By the way, when you use a cannula, you don't aspirate all the time. So you can aspirate, can be a safety. What I do, I move, and I create a pyramid, a bolus, but more like a pyramidal shape of my product, okay? I stay away from this line, always. What you have to think about is, my entry point here is here, but where is the end of the needle? So the end is here. Ça va? You okay? Mm-hmm. Okay. I'm on the bone. Yes. I'm on the bone. The infraorbital nerve is very medial. It's not medially a mid-pupillary line, but more medial in this line. Okay, so you see I'm injecting. The time I'm speaking, I'm always injecting. And I like these B-soft syringes. They're really easy to use, and you palpate really the syringe and also you know where you are with the tip of your needle. And exactly what Denis said, you feel every single layer you feel it, thanks to this syringe. Okay, so now we are using already 0.5. Another trick on the syringe, it's not from 0 to 10, it's from 10 to 0, so you know how much you have injected. You don't have to calculate by minus, which is something very simple but very clever. Okay, so this is 0.6. Will you try to move a little bit medially and use 0.7? Right, okay. So before I do the massage, look at the camera. Okay, you see I shorten the lower eyelid compared to this one. It's very long and sunken. Turn the face this way. You see how flat and concave is here and how more convex is this area now. And this is just before the molding. So what I do is I put my finger on the gel and I push the gel a little bit more medial. It's not a strong massage, it's just molding. And sometimes it's enough to treat the tear trough. Can you zoom on this area, Tony? Oh, no. So if you look at this side, okay, and now you look at this side, okay, you see that we shorten this lower eyelid. Look up, please. Well, you see lower eyelid is almost 2 centimeters or 3, and now it's just this part, which is 0.5 centimeter. That's the secret with just 0.7 cc of the gel. Okay? Are you okay? Yes, so you're going to be a bit numb, and you can zoom up, thank you. For the accommodation, and when you see, it's a bit, when you smile, it's a bit numb for 1 or 2 hours, okay? Or if you drive, or you see, we also, look at the camera, we change a little bit the shape of the eyelid, a little bit higher on the left side. So now I want to do is, I want to inject, can you give me XXL, please? I want to inject laterally to project this area to create a kind of lifting effect. So it's not a lift, it's just a projection this way. So I'm going to use a very easy entry point. Can you hold the skull here? Like this. Thank you. A bit higher. Oh, no. Okay. Alors, every time you inject, you use alcohol swab antiseptic because we inject deep. You use gloves. You remove the makeup, even if the patient doesn't want to remove it. Yeah? I know. We have the same problem everywhere. So then, where you have the change of the curve, you see this is like horizontal and then this is a bit vertical. At the change of this shape, we can inject here. So if you don't know where to inject, again, you draw a line from the corner of the mouth to the tragus, like this. The second line from the nostril to the tragus, and at this junction here is where you inject. Or you do it by heart, or you look like on the 3/4 view and you say, okay, I want to project this area. So this is clean. Then I go perpendicular down to the bone. It's okay? Yeah? Yeah. Bon. So I didn't choose her. Huh? I don't know her before. She's not numb. She's not on general anesthesia. She's not my friend. She's going to be my friend, by the way. Yeah. Yeah. So I'm doing an injection on the bone. And now, as I'm injecting close to the periosteum, I create a pyramid bolus. And I can use a little bit more superficial, this injection. So I turn my syringe to see how much I injected, 0.3 for the first injection point. Okay? Voilà, so when you have a bit of, it's not bleeding, just clot, you just put your finger and you wait. I want to project a little bit here, so this is my second injection point. You okay? Again on the bone. And this is 0.1. Okay? Look at the change. You see, I have this more projection there. And if you look at her on the front view, you see, I have this, what we call the S, lazy S, or the OG curve. And that created the illusion that she had a facelift, or a lift, not a facelift. See, so you can remove that. So this is flat, and this is more bumpy, okay? And this is only 0.7 and 0.4 ml, okay? And as I want to finish nicely here, I can use on the zygomaticus bone. Can you give me the skull, please? Well, I inject on the bone from this side. So don't do that on your patient. Okay, so you know where I am at this junction here. Thank you. Because I want to recreate this nice triangular shape of this zygoma, which is the end of the malar projection. Voilà, thanks. So this is already 0.5. So we use 0.5 ml. You see the, okay, this side. Down a little bit, and that side, okay? So we have the illusion that this is a bit lifted. This XXL deep on the bone, stretch all the soft tissue and pull out those tissue and create, I don't know if you can see it, a little bit of a shadow. This is what women you do with the makeup. The makeup artists, they create some shadow here and some light projection, okay?